I'm Lisa Birnbach. Any woman battling breast cancer is dealing with a variety of emotions and stress, including the fear that she's becoming a burden to her family and her friends. Dr. Mary Jane Massey, a psychiatrist who specializes in breast cancer issues at Memorial Sloan Kettering in New York, is here to help us through. Thank you for joining us, Dr. Massey. How does a newly diagnosed patient with breast cancer not feel just overwhelmed with everything she has to do?
I think most women who've just been diagnosed with breast cancer probably do feel overwhelmed with everything they have to do, because they have to do a lot of things. In a short amount of time, women hear that they have breast cancer. They hear a lot of information about various treatment options. They may want to interview doctors, different doctors, then make a decision about an appropriate treatment for themselves. And often time is of the essence.
How do you help people get through it?
So we look around to see who can help us. And I think we women realize that someone needs to pick the children up from school and meals need to be delivered to the home, and that the woman who's been diagnosed with breast cancer is going to need some extra special help while she starts learning about her illness and making decisions for herself.
Now, alongside all these tasks could be tremendous fear. Am I going to die? Is this going to shorten my life? Will I lose my hair? Will I lose my breast? Etc., etc. How do you help patients manage their fear?
Those fears are real, and I think that all of us need to acknowledge when we have been given the diagnosis of what is potentially a life-threatening illness. Of course we're wondering, is this a treatment I'm going to get through? Is this an illness I'm going to get through? And if I complete my treatments, how long will I be alive? But I think that doctors are happy to address those issues with patients today. Not so in the past, but we realize those are the universal fears that every woman experiences.
Dr. Massey, has there ever been a study about the power of the word cancer?
I think that cancer was such a powerful word that 40 years ago we didn't use it.
Is that
Doctors
right?
talked about lumps and bumps and masses, but women were often not told that they had breast cancer. They knew they had breast cancer, but the doctor was afraid that that word was so powerful that we simply couldn't talk about it. Fortunately, times have changed right now.
Many women are uncomfortable asking other people for help. How do we ask our loved ones for help without feeling like we're burdens?
Yeah. I think that that's a large problem that a lot of women have. Many of us are highly competent in our homes, highly competent as parents, so competent in our careers and in our jobs, and we're not really accustomed to having people help us. We're the helper people. So I think what we remind people is this is a time in your life when people should be helping you, and it's okay to ask for help. When your best friend says, I want to pick your children up from hockey practice every night and bring them home, what we say is, thank you. That will be very helpful.
Repeat after me. Thank you. That will be very helpful.
Exactly.
So don't let it cramp your self-esteem.
And when someone says, what may I do to help you, I think sometimes people think, my goodness, I have to think for you and for me. But I think that sometimes people really are saying, I would do better if you gave me a very specific job, and then I can help you in ways consistently during your treatment that will be of help to you.
So a loved one should be encouraged to say, be specific.
Absolutely.
So I can help you better.
Absolutely. A loved one should be encouraged to to ask for specific instructions.
And if you're facing breast cancer, you may be surprised to see which of your friends really stand up for you, are really there for you.
And some people are so pleasantly surprised to see how many people love them.
Yes.
How many people who really offer to help in a very significant way.
Thank you, Dr. Massey. For more information, please go to Susan G. Komen for the Cure at www.komen.org or call the Komen for the Cure helpline at 1-800-I'm-AWARE. I'm Lisa Birnbach.